California Youth in Crisis, How the Expansion of Telehealth Can Bridge the Care Gap. This is Group 10, and we are Brandy Raymer, Joseph Kelly, Victoria Sun, and my name is Wendy Miares. The prevalence of mental health in children. Currently, there's no available data from Los Angeles County specifically addressing the mental health needs within children. But in a study conducted by the California Health Care Foundation, 1 in 14 children have emotional disturbance, and 63% of those children did not receive care. Innovation created through need. The COVID-19 pandemic has increased our need for telehealth services. Prior to March 2020, 11% of adults were using telehealth services. And after July 2020, that increased to 46% with a satisfaction score of 74%. The COVID-19 pandemic has created an increased need for telehealth services, which is a market we're choosing to analyze. LA County has decided to provide telehealth services to children within its county. Now I'll bring it over to Victoria.
Thank you, Wendy. The two frameworks that we selected to analyze the impact of telehealth and access to mental health services for youth enrolled in LA Unified School District are quality of care and innovation. For quality of care framework, we found that telehealth mental health service at school offer convenience and accessibility, and they are effective for routine consultations. However, when more complex care is required, telehealth services may not be sufficient. Telehealth in school can also promote patient-centered care, and it is a safe option for both provider and patient. We also found that telehealth can improve after-visit care by making it easier for patients to follow up with their physician and manage their care plans. Quality of care framework can be analyzed using several relevant measures of conduct, such as process of telehealth mental health consultation and the quality of interaction. Due to the limited available data for LA County to date, we viewed a national survey that analyzed trends in telehealth using 2021. Based on the survey results, we can infer that telehealth services were widely used, and the telehealth consultation process was well received during the COVID-19 pandemic. Next slide, please. For the innovation framework, we found that telehealth is a disruptive innovation in the healthcare world, and providing telehealth to kids in school is a second disruptive innovation that could change the way mental health is provided to kids. The innovation framework within mental health service delivery can assist in analyzing a hospital's infrastructure, policies, and regulations. For policies and regulation measure, we evaluated the measure of structure by researching the LA County Department of Mental Health telehealth policy, and we found that telehealth services in LA County comply with state and federal laws and regulations, and also adhere to the same standards of care as in-person care provided by qualified healthcare professionals. Next slide, please. Types of changes that may be expected to support innovative and improved quality of telehealth access to mental health services for LA County students can include additional communication channels, easier scheduling of appointments, tailored care to meet individual needs, innovative approaches to care such as technology and creative intervention, and providing resources for self-help. LA County has a low telehealth participation rate, and providing mental health care via telehealth at school can create equity for students who may not have access at home. Next, I'll pass to Joseph to talk about our stakeholder analysis.
All right, so the stakeholders include healthcare practitioners and patients. So we focused on our stakeholders that will be in residents and patients of California and practitioners from both in and out of California. Now we're going to talk about the pros and cons. So patients appreciate the convenience of the safety of virtual visits, which allows the populations living in rural areas and lacking transportations to receive care from a distance, especially for those who have any remote access from far distance. Also, urgent care cases, especially for patients that are having COVID or any flu symptoms that needs medications to prevent from further sickness that will lead to hospitalization, will be in good case. Thus, the senior patients that has diabetes or any simple help in matter of time, for example, strokes, they can be either refilled by seeing practitioner virtually or ask for guidance that is related in matter of time. And operational workflow of these hospitals will be impacted as the staff previously assigned to in-person visits will have a reduction in their workload. An increased attendance rate for students who attend school or homeschool will be the pros. Now we're going to talk about the cons. Cons will be issued with the technology and access to broadband internet, including need for in-person visits for certain types of care, such as surgeries and infectious disease patients that are needing to be seen physically. And adoption of telemedicine as an alternative method for providing healthcare services and could potentially disrupt the liability arrangement for hospitals and healthcare providers. Learning experience of healthcare providers could also be affected, which a significant portion of their education is gained through hands-on experience on the bedside. Lastly, we talk about infants that needs regular checkup will be lacking in lack of getting regular physical, and will all be also affect in decreased vaccine rate for preventive care, since patients are becoming to stay home instead of going out in public.
Hi, everybody. So I just want to talk really quickly about how mental health services have transformed with the use of telehealth. So pre-COVID, basically, mental health services were provided in person most of the time. You would talk to a therapist, they would help you manage your medications. Well, recently, there's been companies such as BetterHealth and Talkspace who have really helped us transform the way that we see mental health services and have increased the availability of these services to people. Next slide, please. In schools, mental health services have always been provided, right? There's always been guidance counselors, or teachers would help a student who they knew was struggling. And 96% of schools surveyed said that in 2021 to 2022, they offered mental health services in schools to students, but only 17% via telehealth. So this is new. And in LA County, there's a company called Hazel Health who's going to be providing these services. And we don't have a ton of data because it is so new. They didn't actually start providing these services until 2021. But we do know from the data that we do have that it can lead to increased attendance, improve morale and test scores, and improve clinical outcomes for students that need mental health services. Next slide, please. So some of the recommendations that we have decided as a group after through our project have, the first one is to manage efficiently, which might sound easy, but it's actually pretty complicated. In order to ensure equity, we need to make sure that one neighborhood and one school isn't being favored over another school, and that all students have the same availability to these mental health telehealth services as the next student. We need to be able to track success through surveys and suspension and expulsion rates and test scores. And in order to do that, we might need to survey families and teachers and the providers and the students to figure out if this program is actually working. Next slide, please. Our second recommendation would be to increase funding. LA County was really excited to state in their news brief that they were utilizing $24 million to help 1.3 million kids over 2 years. But really, that's just $9.24 per child over a 2-year period. So while not all kids are going to need mental health services, we know that that's not enough funding for the need that they will have. Our third recommendation was to offer services to staff because of the high rates of anxiety and depression and stress among educators. And specifically in LA County, at the beginning of the 2022 school year, they were short-staffed by 10%. Last slide, please. Our final recommendation would be to engage the community and the healthcare systems within Los Angeles County. So even though Hazel Health is a national telehealth provider, and they're going to be providing these services, it doesn't mean that the community can't get involved. They're going to have to partner with the school district and these healthcare systems to help families in crisis and to support those students whose needs are too great to be met on a telehealth level. And they can also create community education for families and support groups in order to foster that community strength. And lastly, we want to point out that since some of these students are going to be getting services at school, it might open up some more mental health services to the community of Los Angeles County and can only foster a greater strength and healthcare needs being met there. So lastly, I'm going to turn it back over to Wendy to conclude for us.
Thank you, Brandy. The story of one person is a story of all humanity. Telehealth is a key to healthcare access by reducing healthcare disparities and thereby increasing access. Thank you for watching, and this is group 10.